Namaste, and welcome to our continuing series on homeopathy with our beloved Dr. Pachagavakar. Could we take up hiccups today?
Sure. See, hiccup is very common. In general, everyone gets hiccup once in a lifetime. But the commonest understanding of hiccup is even in our childhood, the elderly people would advise once there is hiccup, they would say drink water. So if you are dehydrated or you have not consumed ample of fluid, then the hiccup comes. It's a natural reflex. Body develops in the form of hiccup, and then if you drink adequate quantity of water, it subsides. This is where there is no underlying pathology behind it. But we have come across certain instances where what we call renal failure, where serum creatinine, blood urea is raised, and there the person develops hiccup. So sometimes hiccup can be indicator of renal failure. So it can be very trivial, at the same time it can be very serious. Whereas there are some cases where because of the side effects of drugs, people develop. We have seen this quinine. Many people who have been given quinine, which is an anti-malarial drug, and they develop hiccup. So hiccup can be because of so many factors. It can be just ignored, or at the same time it can be an indicator of something serious disorder. And in renal failure, everything is fine. Means, you till the end, you hardly get any symptom. So unexplained vomiting or unexplained persistent hiccup, these are indicators of renal failure. And we can get even cases where unduly one gets hiccup and no other underlying complaint, just drink ample of water and it subsides. Homeopathy has remedies for hiccup if it is a tendency of the person. Noxomica, it's a common remedy for digestion. Yes. So Noxomica gives hiccup where the person has not had adequate sleep, indigestion is there is element of colitis, gas, and Noxomica can work wonderfully well. Then we have again Natrum muriaticum is a remedy where there are side effects of quinine, and if that has given rise to hiccup, the Natrum muriaticum is the remedy which can help. But at the same time, if it is a renal failure, one has to take care of that renal failure, and then the hiccup subsides. So hiccup can be very distressing.
If it's constant, yes.
Yes, if it is constant, like it's embarrassing. You just can't control it. It's just a reflex you get. But at the same time, if you drink ample of water, that's why we always suggest that you drink water half an hour before you eat anything. Because once you eat food, even if you go on drinking water, it doesn't, reach your body system. It has to get lodged in the stomach, then churned everything, and then once the emptying occurs, then body gets it. So we suggest that you drink water in anticipation before you eat, and then you can get rid of this habit of hiccup.
Wonderful. Thank you, sir.